We are hearing a first-hand account today on how the strain on the healthcare system is impacting patients in Ontario. A family of a 6-month-old infant spent more than 11 hours waiting to see a doctor after an allergic reaction. CTV's Sean Lethong has the story.
Look at that.
Playing with their son Lucius, Vanessa and Janicije Karic are shaken by their experience with the healthcare system in Ontario.
Very disappointed, extremely frustrated. I think if anything, we were both very angry.
On Thursday, 6-month-old Lucius had an allergic reaction to eggs.
It was scary. It was scary for the fact that we didn't know how bad it could be. We didn't know whether he was anaphylactic or not because this was his first time eating solid foods.
You see your own child getting sick, they can't even communicate. You want the best for them immediately.
The first time parents packed up, heading to the emergency room at the hospital for sick children. It was 8:30 last Thursday night. They were told wait time was 4 hours.
As we kept sitting there hour after hour, it kept increasing.
Tracking through an app, they could see the wait time above 8 hours, then 9 hours, eventually over 11 hours, all waiting in a room full of parents and kids.
Parents losing patience, parents crying, parents getting angry. It's frustrating, man. Very frustrating.
All while fearful that their child could get worse. Finally, 11 and a half hours after arriving, Lucius was seen by a doctor around 8 a.m. Friday morning.
The first thing she said is, "I'm so sorry. I started my shift at 4 a.m. and there's around 58, 60 patients here and I'm all alone."
As they think of the waiting room full of parents experiencing the same wait times.
And we're all waiting for about 11, 12 hours overnight to just see one doctor. And it's upsetting.
We reached out to the hospital for sick children to ask why only one doctor was working during that period, allowing wait times to be so long. Sick Kids sent a statement that says, in part, when there are unexpected surges in patient volumes, this can lead to longer wait times for patients with lower acuity complaints or concerns. The Sick Kids ED physician and nursing staffing model is built using data and analytics to match predicted patient arrivals. We also employ a backup system to manage staffing if team members are unable to work or if there is an unexpected increase in patient volumes, ensuring that a minimum staffing level is always maintained. We also reached out to the Ministry of Health, who did not respond to our request for comment. Lucius was given an EpiPen and will follow up with an allergist, while Vanessa and Janicije say it was important to speak out of their frustration.
Not at the nurses, not at the doctors, not at Sick Kids, just at our government. We're really angry at our government.
People at home, they might not realize how bad this is, right?
Saying the lack of care for staff in the system has to stop. Sean Lethong, CTV News.